Hi friends, welcome to Nursing Jellyfish. In our channel, we are preparing for all nursing competitive exam, NLEX, Prometric, HARD, ESIC, MRB, RRB and also AIMS, NORCET, DHS, all nursing important questions available. So kindly watch till end it is. Today let's see the questions. First question. Andrea with suspected rheumatic fever is admitted to the pediatric unit. When obtaining the child history, the nurse considered which information to be the most important it is. Option A fever that started 3 days ago. Option B, lack of interest of food. Option C, a recent episode of pharyngitis. Option D, vomiting for 2 days it is. So whenever you got a rheumatic fever, so you should ask the person that is you previously got any throat infections or not, because this throat infection is caused by streptococcal infections. This streptococcus is going to be affect the heart and also skin, bone, joint, everything it is. It going to make a rheumatic fever it is. That is why you got any throat infection. So here it is fever, lack of interest in food, vomiting, it won't affect it is. Only the option C, recurrent episode of pharyngitis, it going to cause the rheumatic fever. That's why option C will be the correct answer. Next question. A nurse is providing instruction to a client in the first trimester of pregnancy regarding measures to assist in reducing breast tenderness. The nurse tell the client to option A, wear tight-fitting blouse or dresses to provide support. Option B, wash the nipple and areola area daily with soap and massage the breast with lotion. Option C, wash the breast with warm water and keep them dry it is. Option D, avoid wearing a bra. So actually the mother is having breast tenderness when it was happened in the first trimester. So what type of advice you will tell? Shall I tell the mother to tight fitting or maybe bra or maybe avoid wearing the bra? It won't affect the breast tenderness. Okay, and if you are applying the daily with the soap and also massage the breast with lotion, what will happen? It will affect the breast tenderness and nothing else. It will create, if you are applying lotion, other things are sometimes going to make a crack it is. So that means what is the best advice you will provide? Wash the breast with warm water and also keep them dry it is, because if you are keeping them dry and also breast tenderness, it will be relieved by the soaking of the water it is. So that is why option C will be the correct answer. Next question. A nursing instructor asks a nursing student who is preparing to assist with the assessment of pregnant client to describe the process of quickening. Which of the following statement, if made by the student, indicates on understanding of this term it is? So actually the question is quickening. Okay, option A, it is the soft blowing sound that can be heard when the uterus is auscultated. Option B, it is the fetal movement that is felt by the mother it is. Option C, it is the irregular painless contraction that occur throughout the pregnancy. Option D, it is the thinning of the lower uterine segment. Actually, what is the question here? How the student will describe the term of quickening it is. What is the term of quickening? How the students will describe it is. What do you mean by quickening? That is fetal movement felt by the mother it is. That means option B will be the correct answer. Next question. A nurse midwife is performing an assessment of a pregnant client and is assessing the client for the presence of ballotment. Which of the following would the nurse implement to test for the presence of ballotment? Option A, palpating the abdomen for fetal movement. Option B, auscultating for fetal heart sound. Option C, assessing the cervix for thinning. Option D, initiating the gentle upward top on the cervix it is. See, what is the question here? Ballotment. How you will assess the ballotment? Ballotment means it is a technique used to palpate the fetus. The examiner places a finger inside the vagina and tap gently upward, causing the fetus to rise. The fetus then sink and the examiner feel a gentle tap on the finger it is. That is why option D, initiating the gentle upward tap on the cervix, will be the correct answer. Next question. A pregnant client is making her first antepartum visit. She has a 2-year-old son born at 40 weeks, 5-year-old daughter born at 38 weeks, and a 7-year-old twin daughters born at 35 weeks. She had a one spontaneous abortion at 3 years ago at 10 weeks using the GTPAL format, that is obstetrical score format. The nurse should identify the client. What is the obstetrical score? We have to be identify it as option A, Gravida 5, term 2, preterm 2, abortion 1, live birth 4. Option B, Gravida 5, term 2, preterm 1, abortion 1, live birth 4 it is. Option C, Gravida 4, term 3, preterm 1, abortion 1, live birth 4 it is. Option D, Gravida 4, term 3, P2, that is preterm 2, abortion 1, live birth 4 it is. So what could be the obstetrical score it is? First you think of it, how many number of pregnancy it is. Totally how many pregnancy? That is 40 weeks, 38 weeks, 35 weeks 2 and also 10 weeks and at current pregnancy. So totally how many pregnancy now? Totally 5 pregnancy. That means gravida is 5 it is. Next term how many term pregnancy? 40 weeks, 38 weeks. Other thing is comes under the preterm and other abortion. So that is only the 2 term pregnancy. And next preterm delivery, how many preterm? 35 weeks it is. That means only 1 preterm baby it is. Next, how many abortion? Only 1 abortion. Okay, next live birth. How many live birth children are living there? 4 children. That means what is the correct answer here? Option B, G5, term 2, preterm 1, abortion 1, live birth 4 is a correct answer. If you want more question, you can download Nurse Genius and also Target All Exam app. You will get all nursing competitive exam papers. Okay, move on to next question. The pituitary hormone that stimulates the secretion of milk from the mammary gland is option A, prolactin, option B, progesterone, option C, estrogen, option D, oxytocin. Progesterone and estrogen is helping for maturation of the ovum and ovulation and pregnancy it is. Oxytocin for helping for contraction of the uterus and also for prolactin only the pituitary hormone going to give the secretion of the milk it is. That means what is the correct answer here? Yeah, option A, prolactin will be the correct answer. Next question. In a lecture on sexual functioning, the nurse planned to include the fact that ovulation occurred when the option A, blood level of LH is too high, option B, endometrial wall is left off, option C, oxytocin is too high, option D, progesterone level is too high it is. So what would be the correct answer? Endometrial wall related to the menstruation, oxytocin related to the uterine contraction, and the progesterone is going to be related to the pregnancy. Here what is the sexual functioning? So what is the correct answer here? Yeah, LH, luteinizing hormone, that will be the helping for the ovulation. So that is why option A will be the correct answer. Next question. Which of the following symptoms occur with the hydatidiform mole? Option A, heavy bright red bleeding every 21 days. Option B, beetle cardiac motion after 6 weeks gestation. Option C, benign tumor found in the smooth muscle of the uterus. Option D, snowstorm pattern on ultrasound with the no fetus or gestation sac. Usually hydatidiform mole, there is no fetus and also no gestation sac will be, and also when you are going to looking the from the ultrasound how it was looking there, it was looking snowstorm appearance. When you looking the picture you will come to know how it was appeared. So that means option D will be the correct answer. Next question. After the first 4 months of pregnancy, the chief source of estrogen and progesterone is option A, adrenal cortex, option B, placenta, option C, corpus luteum, on option D, anterior hypophysis. Usually what is going to be corpus luteum is going to be related to the menstruations and other maturation of the womb. Anterior hypophysis, it won't be affect the pregnancy. Adrenal cortex, it is apart from that it is. Only the placenta is helping for estrogen and progesterone maturations up to 4 months of pregnancy. Only placenta is helping to maintain the pregnancy. That means option B will be the correct answer. Next question. During a perinatal visit at 38 weeks, A nurse assesses the fetal heart rate. The nurse determined that the fetal heart rate is normal if which of the following is noted. Option A 180 beats per minute. Option B 80 beats per minute. Option C 100 beats per minute. Option D 150 beats per minute. When you are going to do the ANC assessment, so what it is coming, normally the fetal heart is 120 to 160 beats per minute. If it is 80 and 100, it is a fetal bradycardia. If it is 180, it is above, it is coming. So that means 150 beats per minute will be the correct answer, because it is a normal fetal heart rate is 120 to 160 heart rate it is. Okay, option D will be the correct answer. Next question. A nurse is reviewing the record of client who has had been told that pregnancy test is positive. The physician has documented the presence of a Goodell sign. The nurse determined this sign indicates option A, the presence of fetal movement, option B, a soft blowing sound that corresponds to the maternal pulse during auscultation of the uterus. Option C, the presence of Hashiji in the urine. Option D, softening of the cervix it is. In early pregnancy, what will happen? The cervixes become softer because of the increased blood circulation and also hyperplasia. That is why the cervix look like a softening of the cervix is going to be called it as Goodell sign it is. That means option D will be the correct answer. Next question. A nurse is caring for a pregnant client with a preeclampsia. The nurse prepare a plan of care for the client and document in the plan that the client progress from preeclampsia to eclampsia. The nurse first action is option A, administer oxygen by face mask. Option B, clean and maintain an open airway. Option C, assess the blood pressure and fetal heart rate. Option D, administer magnesium sulfate intravenously. Actually, what is the question here? The pregnant mother is going to become pre-eclampsia to eclampsia. If the person is getting eclampsia, automatically seizure or fits will come. So automatically what will happen? It will affect the blood circulation and also affect the airway. So first priority is airway. So airway is going to be obstructed, not able to breathe. So that is why what we have to do? Clean and maintain the open airway will be the priority action for the mother it is. So option B will be the correct answer. Next question. At a prenatal visit, 36 weeks of gestation, a client complains of discomfort with irregularly occurring contraction. The nurse instructs the client to option A, time contraction for 30 minutes. Option B, lie down until they stop. Option C, walk around until they subside. Option D, take 10 grams of aspirin for the discomfort. First of all, you think of it, whenever the 9th month was started, 36 weeks of gestation, the mother will get false contraction. That is, frequently you will get a Braxton Hicks contraction. That will be normal. First you have to tell. Next, if the person is getting Braxton Hicks contraction, if you are changing the position, automatically it will be subside that. For that better, you can tell the mother to walk for some time. That is, walk around sometimes until changing the position, it automatically subside it is. That is why option C will be the correct answer. Next question. When involved in a prenatal teaching, the nurse should advise the client that an increase in vaginal secretions during pregnancy is called leukorrhea and it is caused by increased option A, metabolic rate, option B, production of estrogen, option C, supply of sodium chloride to the cells of the vagina, option D, functioning of the Bartholin's gland it is. What you mean by leukorrhea? That is increased white discharge it is. White has happened during the pregnancy because of the estrogen stimulation, hyperplasia of the vaginal mucosa, and it leads to increased production of the endocervical glands. Okay, the gland is going to produce the more secretions. So that is why you will get a exfoliated epithelial cells also going to produce the more mucus. So that is why you are getting the leukorrhea. So according to this option, which is the correct answer? Production of estrogen, option B will be the correct answer. Next question. The antagonist of magnesium sulfate should be readily available to any client receiving IV magnesium. So which of the following drug is the antidote for the magnesium toxicity? Option A, hydralazine. Option B, argachuagam. Option C, Nargon. Option D, calcium gluconate. Actually, what is the antidote for magnesium toxicity? Everyone knows it is. What is that? Calcium gluconate it is. So how we will administer 10 ml of 10% calcium gluconate is given IV push. Only 3 to 5 minutes you have to be administered very slowly, and the same time you have to monitor the side effect and complications also. Next question. A prenatal nurse is providing instruction to a group of pregnant clients regarding measures to prevent toxoplasmosis. Which statement, if made by one of the clients, indicates a need for further instruction? It is option A, I need to avoid touching mucous membrane of the mouth or eyes while handling raw meat. It is option B, I need to cook meat thoroughly. Option C, I need to avoid contact with materials that are possibly contaminated with the cat feces. Option D, I need to drink unfactorated milk only. So which will be the correct answer? This all touching and meat, everything is going to be not affecting the toxoplasmosis, but the milk is going to be unfactorated milk is going to cause for the toxoplasmosis. That is why, what is that? You have to tell the mother option D, I need to drink unfactorated milk only. That will be the correct answer here. Next question. The developing cells are called a fetus from the option A, time the fetal heart is heard. Option B, 8 week to the from the time of birth. Option C, implantation of the fertilized ovum. Option D, end of the second week of onset of the labor. It is actually, what is the term to describe the fetus? It is, that is a question here. So usually what is that? It is from the 8th week to the at the time of birth. This all the things going to be called it as fetus. Other things are implantations and end of the second week, that it won't come for the fetus. It is only the lifestyle. See, the first 7 to 14 days, it is a ovum is known as blastocyst and also called embryo until the 8th week. After 8th week to up to till birth only, it is called it as fetus. That means what should be the correct answer here? Yeah, option B will be the correct answer. Next question. The nurse recognized that on expected change in the hematological system that occurs during the second trimester of pregnancy is option A, on increase in blood volume. Option B, increase in hematocrit. Option C, decrease in WBC. Option D, decrease in sedimentation rate. It is actually, if the person is having second trimester of pregnancy, what is going to be happen, that the blood volume is going to be high and also hematocrit level is going to be decreased. Okay, and the same time increased blood volume is going to come. Not decrease in WBC, decrease in sedimentation, it won't happen that. Only the option A, increase in blood volume will be the correct answer. A pregnant client calls the clinic and tells a nurse that she is experiencing leg cramps and is awakened by the cramps at night. To provide relief from the leg cramps, the nurse tells the client to option A, dorsiflex the foot while flexing the knee when the cramps occur. Option B, plantar flex the foot while flexing the knee when the cramps occur. Option C, plantar flex the foot while extending the knee when the cramps occur. Option D, dorsiflex the foot while extending the knee when the cramps occur. Actually, why the leg cramps was happen, that it is stretches of the leg, plantar flexes on the foot. It is, that is why cramps are coming. So if it is plantar flexion only, the leg cramps coming means what should do for the relieving measures? Yeah, dorsiflex the foot while extending the knee will be relieving the muscle to relax it is. So that is why option D will be the correct answer. Next question. The 12-year-old boy has fractured his arm because fall from his bike. After his injury, he is being casted, the plaster of Paris. The nurse knows that it is important to perform all of the following assessment on the area to distal to injury expect. So what is the answer here? Except they are asking. Option A, skin integrity. Option B, finger movement. Option C, radial and ulnar pulse. Option D, capillary refill it is. Actually, when you are going to apply the plaster of Paris, what are things you have to assess? You have to assess the capillary refill, you have to assess the pulse also, radial and ulnar pulse, even for finger movement you have to check for. That is all the things that has happened because of the absence of compartment syndrome. You have to check it. Okay, and which is the except option, that is skin integrity. So it will be the least option. So that is what is the correct answer here? Option A will be the correct answer. I think you have understand all the question and answer. If you like this video, please like and subscribe my channel, and also all the best for your exam. Thank you for watching.